Hello, everyone. We're now in Module 5, and we're getting very close to the final elements for the project that you'll submit later this term. I'm very glad to see some of the components that you all have been discussing in the Module 3 and 4 discussion forums, because it gives me a good idea of where you all are in terms of some of the key terminology related to program evaluation. What I'd like to do today is talk to you a little bit more about the importance of some of the terms that we're going to discuss here in Module 5 and how they'll specifically help you in terms of some of the discussion and activities that you'll be working on this week and in the weeks leading up to your final project submission later this month. So when we talk a little bit about these ideas of the subcomponents of evaluation, I really want you all to think about this notion of whether or not you are specifically looking at elements of formative, process, impact, or outcome evaluation. So specifically what we're doing is we're looking at the notion of in what way are we intending to collect sufficient data to determine whether or not our efforts are having the intended effect that we hope for. We want to make sure that we collect measurable information and also that we have ongoing data collection to ensure that the results from our program are collected before, during, and after implementation. So this is important in terms of thinking about the decision-making process and also whether or not there may be unexpected benefits or concerns related to our program intervention. We also could find out whether or not there could be some aspect of our program that requires some sort of ongoing review. Or it could be that we need to assess whether or not the program goals and objectives are being achieved. There are usually 4 stages of evaluation, and in the simplest terms, they're defined as follows. For formative evaluation, you're looking at identifying problems, needs, and identifying risks related to your specific problem. So this is the identification phase. When you get to the process stage, this is when you're looking at the implementation component, such as workload, efficiency, and program satisfaction. Impact usually gets at measuring knowledge gained, risk reduction behaviors, and adoption of any laws and policies. The impact stage can also entail short-term analysis that can be used to measure results. When you get to the outcome component, you're looking at changes or reduction in loss data, whether you're talking about morbidity or mortality data. This can also be other correlates such as property loss, and for example, injury data, or number of responses. You can also be seeking things broader in terms of economic expenditures and other aspects such as health-related quality of life. This also involves a component of long-term analysis used to measure results, and it may take many years to see reductions in this scope. So think of your outcome evaluation as long-term and your impact evaluation as short-term. Now, what I'd like to also discuss in terms of some of this terminology is what we mean by the idea of the process evaluation. So specifically, this is the data collection that determines if a program was successfully implemented as it was originally designed. And if it wasn't, your evaluation is going to determine whether the program's current operations differ in some way compared with the original program's operations. The results of your process evaluation will answer one of 2 questions. What services are being delivered and who is receiving those services? So this is where we get into the notion of activities. And as you can see here in this example, this was specifically an example of a community risk reduction program related at helping a community with fire loss prevention, specifically within a community. And it's specifically dealing with looking at strategies for a vision for community risk. When we think about this notion of outcome evaluation, we know that every public health program has goals or outcomes that it aims to achieve. An outcome evaluation determines if the program's goals were met. A positive outcome evaluation can be used to justify expanding the program in the future. For example, when a program launches with the goal of decreasing a certain virus, this can actually help professionals to seek to replicate that positive outcome. So think about it this way: your outcome long term is to decrease levels of incidence or prevalence of a certain infectious disease. If you're successful, we'll want to replicate that outcome in future programs that are designed in a similar manner. When we think about the notion of impact, the goal of your program is to have a specific impact on a target demographic. So your impact evaluation is going to use data to gauge the impact of that program and any changes that resulted from it. So for example, data can reveal the long-term impact of, let's say, an anti-smoking program, or in this case, the impact of attitudinal changes and knowledge, attitudes, and beliefs. So think of these in a way that helps you think about what kind of cues were gained from your specific intended audience in terms of learning and action. Whereas an outcome evaluation, you're thinking about the overall health condition and or long-term community condition of that specific nexus that you were focused on. And this can be much broader. So I do think that this specific schema of looking at it in terms of the activities and your process evaluation, individuals who are the focus of the evaluation in terms of their learning and action, that's the focus of your impact, and your outcome evaluation is that long-term condition that you can assess years down the road. So I hope this is a helpful sort of mini tutorial to help you get a little bit of a sense of what some of your readings are discussing. And if you have any questions, feel free to let me know in the chat, in the Canvas, or send me a one-on-one message. I'll see you in the course.